and this is our medical providers update for the November 18th week. I know we just had one a couple of days ago, but we just wanted to update everybody on everything that has been going on since then, and give everybody another chance to just discuss items and topics that are important to everybody. So let me share my screen, and we will go ahead and get started. Okay, can everybody see my slides?
Yes.
Okay, great. Hopefully my volume's okay too. So by way of agenda, we'll talk about cases, hospitalizations, and tiers of the blueprint, and this therapeutic modality, which is a monoclonal antibody called bamlanivimab. I'll give everybody an update about that. Testing related to the antigen testing that we have, which is the Binax Now antigen testing that we've actually been allocated from the state. I know some of you are doing other antigen testing, so I just wanted to touch on that. And then I don't think I have a slide about this, but I just wanted to touch on some best practices related to PCR testing, and then share some details and do a little bit of a deep dive about vaccine planning and preparation, so all of you understand sort of what the approach is going to be from the local health department side, and then some gathering guidance related to Thanksgiving. I'm sure you're fielding calls from patients, from relatives, from friends and neighbors related to safe gathering guidance. And so we hope that we can help you at least have some talking points whenever you have those conversations. So in terms of what's going on in Fresno, we now have 34,765 cases. This caseload is accelerating, and in fact, we are experiencing a surge here in Fresno, and that's really the reason why the state government declared that we need to be much more aggressive about moving the counties that are in danger back into the purple tier, which happened to us in Fresno as of Monday, and also requiring more strict mask usage, so that really anytime you're outside of your house, you have to wear a mask. And that means whenever you're walking outdoors anywhere, whenever you're indoors at a retail place, whenever you're indoors at your place of work, whether that's a clinical place of work, an office-based setting, you need to be wearing a mask at all times. And that basically is to try to reduce the burden of transmission throughout the state. In terms of the number of deaths, we now have 460 deaths, 463 at the time that this website was updated. I think it's closer to 469 now. But that number keeps ticking up, and that's something that we are very worried about, especially when you look at the hospital numbers. So the hospitals are now reporting that they have 151 total cases across all of the 7 general acute care hospital facilities here in the county, including 35 cases in the ICU. When you look at this uptick, it is a little concerning, especially the ICU levels are going up. And that's really the source of the concern, is that the slope of this surge is actually steeper than the slope of the surge that we experienced back in late June, July. And so if this surge doesn't get mitigated and stopped right away, then we're going to be in a lot of trouble in terms of our medical capacity. And that's what we're all very worried about, is that despite the advances in testing, the advances in therapeutics, we still have a real critical moment right now in terms of trying to protect our medical workforce. And keep in mind that it's not just about beds and capacity to place the patients. It's also about the staffing. And we're now experiencing a time when more and more staff are being diagnosed with coronavirus, are being diagnosed with, are being told that they are close contacts and therefore having to quarantine. And that actually cuts into our staffing levels, and all of that becomes a vicious cycle that's really hard to pull out of. At the same time that your number of cases goes up, then your number of hospitalizations goes up, and then your medical staffing goes down. And that's obviously a worst case nightmare scenario. And while all that's happening, all of the other counties are experiencing the same thing. So that requesting the state for more resources in terms of staffing or whatnot becomes less and less tenable. Just to put it another way, this is kind of where we were and where we are now. So as you know, the state looks at testing positivity and case rates in order to assign the tiers. They actually are not looking at what's going on in the hospitals whenever they're assigning the tiers. But I think they did look at what was happening over the weekend and the last week with the hospitalizations all over the state. And that's why they were very aggressive about turning everything to purple if they were at all in trouble. And that now means that 94% of the population of California, so it's really just smaller counties and some Bay Area counties, which are just hanging on to red. The vast majority of the state is now in the purple tier, including us here in Fresno. Our positivity metric has been hovering around 5s, and now it's up to 7. But our case rate metric went from 6.5 to 8.3 to almost 15 just over the course of the last couple of weeks. And so that was something that we really, that should actually say 16 November, not 16 October. But that's basically very concerning for us because these are very high case rate metrics that really tipped us over into the purple tier. Here's another snapshot tool that we have access to that the state creates for us. And this just goes to show you this huge uptick that we've been noticing, which is every day more and more cases. And each of these bars is a single day's worth. And so you can see that for the last about 10 to 15 days, we've actually had just a very high uptick in the number of cases that we've been detecting. So it wasn't a surprise to us. Obviously, we were disappointed that we were told to go back into purple, but it wasn't really a surprise to us knowing that we were looking at the snapshot tool and we kind of knew that we were sliding into purple already. What does that actually mean? Well, a lot of the indoor operations have to close. So that's obviously causing a lot of consternation, and they're even going to have a rally this week about this. But we basically are now requiring indoor restaurant activity to cease, indoor gym activity, other retail activity has to cut down in its capacity. So there's a lot of industry-related kind of triggers that fall into place whenever a county is moved back into purple tier. And that's basically what we're asking people to comply with. It's a little bit of a delicate situation because we're asking for voluntary compliance. There's not a lot of strong enforcement that gets done during times like this. So we're just hoping everybody understands the rationale for why we're asking people to do this. And regardless of how much data we throw out at people, they always want to see more data because they're just not happy to hear that their industry has to get shut down for the time being, or at least operate in a way that they don't really like to operate in. But that's really the rules that the state is setting. It's not really a rule that we're creating here at the local level, and the state is asking all purple counties to abide by these rules, and we really don't have any wiggle room in terms of what we need to require for local businesses. Any questions about that epidemiology section? And the state has said that because we're in a state of surge, they will basically be running these tier calculations probably multiple times every week in order to give even better, up-to-date, accurate, projections about where things are going. And they may even announce some more restrictions before the week is done, including something, they're toying with the idea of a curfew, meaning that everybody has to be at home and in bed and not out at a business beyond a certain time, like 9 p.m. or 10 p.m. And that's just to limit the amount of social activity that's being done at private gatherings, at restaurants, etc., bars. Not that bars can operate anyway, but there's different loopholes that people are exploiting. And the curfew would be just another layer to make people stay home instead of gathering around others where they could spread the illness. So that's the kind of thing that you might hear an announcement about in the next day or two, just if the state moves forward with that rather controversial decision. All right, let me switch gears and just talk about some good news. One of the allocations that we've been taking advantage of is a monoclonal antibody called bamlanivimab, and I will never be able to pronounce that comfortably. If you just have a few minutes, I would suggest that you read this blog under the ID Stewardship blog, which is basically 5 things you need to know about this medication. It's really well written, and it really gives you a summary about what this is. So this is a monoclonal antibody. It can neutralize the virus and prevent progression. They have done clinical trials, including something called the BLAZE trial, which showed that outpatients benefit, but hospitalized patients do not benefit. As you can imagine, this was only done in adults and non-pregnant women, but nonetheless, this was enough for the FDA to grant them an EUA, an emergency use authorization. So now they're authorized to use this medication for outpatient, mild to moderate COVID-19 in adults and kids over age 12. Basically, at least 40 kilogram patients. And then they have to meet the high risk criteria, including a BMI higher than 35, chronic kidney disease, diabetes, immunosuppression, and an age greater than 65. So at least one of the following, and then obviously if they have more than that, then they would be even more higher risk. And then there's an additional high-risk criteria for people that are over age 55 and in the 12 to 17 years of age group. So if the patient's going to be destined for the hospital and getting admitted to the hospital, they would not qualify for this medication. If they require oxygen, they would not qualify for this medication. This is really for the ambulatory patient who just got diagnosed with COVID-19. They're going to be asked to go home to recover. This might help them recover faster. Basically, if they have mild or moderate symptoms, fever, cough, sore throat, malaise, headache, muscle pain, GI, shortness of breath with exertion. So it's kind of an interesting concept because this is a one-time infusion that the person gets over about an hour, and then they go home. And so that raises some interesting logistical issues, like where is the infusion done? Is it done in an emergency department? Is it done in an infusion center? Can it be done at a nursing home, knowing that some of our elderly population that we really want to protect might be residents of a nursing facility? So all of that is being worked out in phases. And basically, I won't belabor this slide, but I'll include this in the packet that we send out this week. But basically, they're working through whether urgent care, skilled nursing facilities, outpatient offices, and other community clinics can get this, can handle doing the infusion. Just remember, there is a small chance of anaphylactic reaction just because it's considered a blood product, an immune product. And in the clinical trials, 1 out of every 150 patients had basically an allergic reaction or an anaphylactic reaction. In this county, right now, our first allocation is about 120 patient doses. So, you know, it wouldn't surprise me if one of those patients had one of these reactions. And that just means that whoever is infusing this medication needs to be ready to treat anaphylaxis and allergic reactions. Obviously, as an emergency physician, this is something that we feel comfortable with doing. And the various infusion centers that might be handling this might also need some in-servicing and make sure that they have all of the medications needed to treat things like flushing, rash, facial swelling, or other more severe forms of anaphylaxis. We've been able to allocate medication to CRMC, Clovis Community, St. Agnes, Kaiser, Fresno, and the Adventist Medical Center in Selma. Just overall, the state got 4,000 vials or doses, and Fresno County got 120 doses. So that's the first allocation. Just like with remdesivir, this is kind of parallel to remdesivir. We'll be getting more allocations to distribute. And then we anticipate that eventually as this pharmaceutical product matures and makes it to the commercial market, that hospitals and other healthcare facilities may be able to pursue purchase just independently of the health department. And so we'll keep everybody posted on you know, where this goes. It's always one of the more exciting parts of this pandemic is to be on the forefront of the basic science. And this is just a really neat new modality that we now can offer to patients who qualify. I know that my colleagues at Community Regional are already working out the protocols about how to operationalize getting this infusion into patients. I'm sure at the other hospitals, all of your committees are also working on this. So please work with your local hospitals to see if you need to be involved in some of the planning related to this. And if you're at the outpatient setting or overseeing skilled nursing facilities, keep in mind that this is where this may end up, is that we actually create some outpatient model that will allow ambulatory patients who don't need to be admitted to the hospital, who don't need to be in the emergency department, to get this infusion and then go right back home, because that's kind of how this drug, in my mind, is designed. And so we'll speak more about that when we get more information about it. Right now, they really want to just base for the first phase in the acute care settings, but they understand that, you know, in later phases and as this program matures, that they will basically be able to allocate to other types of settings as well. Any questions about that so far? Okay, let's move forward to antigen testing. So we actually, as I've told you before, have the Abbott Binax Now cards. This is an antigen test that can be done just basically at the point of care. It does not require any machines. And we have already uploaded this packet to be able to apply for this program on our website. So this is the link to that website packet. If you just look under health messages for medical providers, then you'll be able to see the packet. And in fact, I'm gonna stop sharing this screen and then share my other screen so that I can show you where these things live, if that is okay. Let me see if I can share maybe this screen. So this is the screen that that has the health messages for medical providers, and you can see that it's already up there. It's under a bunch of the donning and doffing videos, so be patient and keep scrolling down. But basically, the health messages for medical providers is along the left-hand side. That's the tab there, okay? Now, this is what I want to show you. This is the actual how-to video for the Binax. Pardon the cheesy music. So the materials, can you guys see this video? I hope you can. Nasal swabs, extraction reagent, and then you have to provide your own stopwatch. That's really what you have to provide. So you do the old nasal swab, rotate the swab 5 or more times, and then do the other nostril also. Okay, so you do one nostril, then you do the other nostril, preferably in the same patient. I'm just kidding. Yes, of course you should do it the same patient. Then you should do the test as soon as possible after the collection. And here they're showing, it's a flip open card. You add the reagent to the top hole, 6 drops on the top hole, and then you're gonna add the Q-tip into the bottom hole, the swab. Okay, then you rotate the swab 3 times clockwise. Then you peel off the adhesive strip, and then you close the book and wait 15 minutes. And that's it. And here's how you interpret the results. I'll pause this section. Remember, one pink stripe is just a control. 2 pink stripes means that it's positive for coronavirus. And there's some invalid messaging here also that you can say if you don't see a control stripe, or if you see just a blue control stripe, or if you see only a sample stripe and not a control stripe, or if you see a blue control stripe and a sample stripe. All of those mean that it's an invalid test, and they're asking you to repeat the results. So this will actually be reported to the Abbott company if you get the Abbott app, which is one of the prerequisites for the starter pack. And then we have an attestation form that is on that packet that I was showing everybody right here in the health messages for providers. And that looks like this. Abbott Binax Now information for healthcare providers. And you could just read through this. Again, you have to have a CLIA waiver. So hopefully all of you who are interested in obtaining this point of care technology already have that. If you don't, then we actually have some information about how to get your CLIA waiver in here. And then basically remember that you're only going to test symptomatic patients within the first 5 days of their symptoms. And you have to be registered in the CalReady system, which is what this page refers to, the CalReady manual laboratory reporting module. We need to get the positives and the negatives and the demographics related to that, okay? Because this does not automatically get entered into the state database. So if you are going to be doing antigen testing, which we certainly hope you do, then you or your medical staff need to report those results back to public health so we can help you with the contact tracing on those patients. At the same time, because by definition you're giving this test to symptomatic patients, you're basically going to order them to stay at home right then and there with an isolation and quarantine packet, which is hyperlinked also inside this packet, okay? And all of that is explained when you read through this packet. All right, let me stop sharing this screen. So remember, and then go back to sharing this screen again. Wow, I'm really expanding my scope of practice with the Zoom. Okay, so remember, download the Abbott app. It's also called the Navica app. That's just what it's called. The Navica app. There's an attestation form and the CalReady registration, and then you have to have a CLIA waiver. Okay, and this is just a screenshot of everything that I just showed you on the website. Okay, it's a four-page kind of instruction sheet that you need to read through, and then a one-page attestation form that you need to send back to us. We won't publicize this, but we'll keep it on file just so that we can keep track of that in case the state needs that. And then obviously, if you run into any problems, if you need any help troubleshooting, if you notice any trends, or really any feedback that you have about this program, we want it. I just want this out by Friday. So if you get me this packet by tomorrow, we will get you some of these cards by Friday. Just to get you ready for your ramp up to Thanksgiving. You're probably going to have a lot of patients come to you to clear them for Thanksgiving gatherings. And obviously, if they're symptomatic, they shouldn't be gathering at all, but at least you can maybe do this antigen test if you get it ready in time so that you can give them a diagnosis so that they can make better decisions based on that diagnosis. So we don't want to lose this weekend, and that's why we really want those of you who are ready, who have expressed interest in this, to have this this antigen kit at your disposal as soon as Friday. Any questions about that? All right. Well, we'll keep on going about vaccines. Okay, so vaccines are in the news. Some would say that there's a lot of conjecture in the news related to vaccines. That's okay. We're excited. I hope everybody is. Again, this is just one of the great, I think, scientific victories of this pandemic is that the rapid timeline of developing vaccines from multiple different pharmaceutical companies that are now in clinical trials. So the way that the state is kind of prioritizing the scheduling of this vaccine is they basically have broken things up into phases according to, I guess, risk categories. So the first phase is going to be phase 1, and then they have phase 1A, 1B, etc. So 1A is basically the jumpstart phase, and they really want this to be like during December. And that means high-risk healthcare workers that are on the front lines, first responders that are on the front lines. They really would like to get those personnel vaccinated as early as mid-December. And so everyone's really working hard to try to make that timeline. A later part of phase 1 would be people of all ages that are at high risk. So if they have comorbid conditions, underlying conditions, if they're older adults that happen to be living in congregate or overcrowded settings, all of those would be considered in phase one. And I'll show you, again, no one has assigned months or dates to this, but this is how they're thinking through this process. Phase two would be our teachers, our childcare workers, critical workers in other industries, people that have comorbid conditions at moderate risk, people experiencing homelessness, mental illness, other intellectual disabilities, and those in other congregate settings like prisons and jails. So basically, everyone else that's at higher risk, that's not covered by phase one, is in phase two. Phase three is young adults, children, and workers in industries that are at increased risk as well. And then phase four is really everyone else. So really everyone should get the coronavirus vaccine. It's just this is the way that it's being prioritized. And I think the very bottom bar is very important. Equity is considered a cross-cutting consideration. So vaccine access should be prioritized for geographic areas identified through the Social Vulnerability Index. And so that actually places Fresno towards the top for getting the vaccine. All other things being equal, is because we have such high levels of vulnerable populations. And I'll show you a map of that in a little while. This is an interesting map that the state has developed. It's basically the number of healthcare workers that we have. And in Fresno County, we have between 50,000 and 100,000 healthcare workers. So that's our workforce. They've also divided it up by facility type. And you can see here that about half, 42%, work in a general acute care hospital. The rest are working in skilled nursing facilities, psychiatric hospitals, residential care, or other facilities. And then they actually divide it up by county. And we are not in the top counties that are represented here. We probably just made the cutoff. We probably just missed the cutoff, and we're considered one of the other counties in this big blue wedge that's not LA, San Diego, Orange County, etc. Lastly, the highest risk staff are in the state of California. Out of 1.1 million staff, about 467,000 are considered highest risk. Okay, so if you count highest risk and high risk, that's already about 700,000 people, that almost 800,000 people that we would need to vaccinate right away, just hopefully in December, January timeframe. And here's what I mean by the vulnerability index. And this is basically breaking up California into 4 different quartiles. And guess what? Fresno is considered in the most vulnerable quartile, along with all of these other counties. So I think the state is going to look at that and really prioritize us as needing vaccine distribution sooner rather than later. But we know that it's going to be a scramble. I would be naive to tell you that this won't feel chaotic as it's being planned out. But the state is really trying to keep in touch with us as much as possible. They're doing weekly, sometimes twice weekly meetings to get input from local health departments, certainly, but also hospital partners, other healthcare agencies, to make sure that this plan kind of works for everyone and that everybody has a voice at the table whenever this is being planned out. So I'll share more updates as we get them. Our team is already trying to do our due diligence in terms of how we are going to be able to host doses of this vaccine, and then also organize vaccination clinics. And that's where our experience with the influenza clinic experience that we had this last fall is really going to lend itself to helping us plan out COVID vaccination clinics. Just a plug for influenza, please keep working on that. All of this vaccine enthusiasm shouldn't distract us from the fact that flu vaccine's already out there. So we need to be able to say that, everyone in our community has the flu vaccine, because it would be inexcusable for us to have just a big or even a small number of fatalities related to influenza when we have a vaccine that's been perfected over decades at this point. Anyway, let me talk a little bit about the Pfizer vaccine, and this is all basically slides that the state has shared with us. So this is an mRNA vaccine. It's going to require 2 doses that are 21 days apart, and it has to be kept at -80 degrees Celsius when it's in storage. Okay, I believe the Pfizer plant is in Kalamazoo, and so that's where it's probably going to be shipped out from. And basically, a cold chain needs to be established, from that factory to all of the end recipients. So it's kind of cool. They're going to be packing stuff on dry ice. One vial actually contains 5 doses that can be used, and each shipper, that's called an ultra low temperature thermal shipper, can have up to 5 trays, which is almost 5,000 doses. In terms of Moderna, Moderna also announced that they have, about a 94% efficacy in the early phases of their trial, or in their interim analysis, I guess. So that's a very exciting development as well. That's also an mRNA vaccine. It's actually going to require 2 doses that are 28 days apart and storage at -20 degrees. So you can sort of see how these vaccine products, each one of them has a different kind of flavor and personality that will require us to really plan around that. And while we have one freezer, I think we won't know which product we're going to get, or if we're going to get a blend of 2 different products. So that obviously we have a lot of questions about where do we set the temperature for that freezer. And at the same time, I know that our hospital partners are also pursuing freezers in order to accommodate this ultra low temperature storage. And people are talking about freezer trucks and dry ice, and how that whole cold chain is now being stressed related to the demand. That's not surprising. I mean, this is really a mad scramble in order to get this vaccine out as best as possible. And so people are already starting to make those kinds of orders just in light of the fact that this is a very pressing timeline. In terms of ancillary supplies, this will be, I think, provided. But just to give you a heads up, these are the kinds of things that we do have to think about, which is, needles, syringes, alcohol pads, surgical masks and face shields, and then really just space in order to keep people safe, because you don't want a mob scene whenever you're going to have this vaccination being distributed. And so really just thinking through that, like, what is that going to look like? How are we going to accommodate people? Can we do drive-through vaccinations the way that we did with influenza, et cetera? Again, very exciting times to be just in on these conversations. And this is what the phases are going to look like. I don't know if this helps. It certainly ties together a lot of the last few slides. But basically, phase 1 is when phase 1A and phase 1B will be serviced. And basically, as we get into phase 2 and phase 3, that's when some of the other populations will be able to access the vaccine. So it's going to be a phased approach. We know that we need, basically 2 doses for everyone in our county. So ultimately, we'll need 2 million doses, assuming that everyone in our county can and wants to get vaccinated. At the same time, vaccine hesitation is a big issue. Some of the early polls about this revealed that, people were enthusiastic about getting this vaccine. Only about 30% of those who responded to the polls. I think that number has gone up now that people have seen some of this science and have understood how it's being conducted. So hopefully it will be more than 30%, but we need to have, certainly into the 80–90% if we're planning to have herd immunity, assuming that the vaccine isn't going to be completely efficacious, and that we have to have some sort of a wiggle room in order to really still achieve herd immunity. Here's some marching orders for the health departments that the state has given us, which is basically identify potential partners. They've already started to do that by surveying all of the acute care hospitals, and then they want us to go through and identify other partners that we are going to be working with. These partners should have staffing levels and capacity to begin vaccination. They can vaccinate with high throughput, coordinate the delivery of 2 doses, so basically keep track of patients. So that kind of throws a wrench into the flu vaccine model, which is that, you just give people a shot and then you say hasta la vista, and you don't have to really keep track or close track of, who they are and how you can bring them back. With these vaccines, we're going to have to call these people back. We're going to have to call them at 21 days and 28 days and tell them, come on back and get your booster, or else the vaccine's not going to be efficacious. So that obviously adds some complications into just the logistical preparations that we'll need to be making. And then the capacity to deliver vaccination during peak influenza season or a disease outbreak like what we're experiencing right now during the purple tier. And then reporting dose level data within 24 hours through this vaccine finder website that they've set up, and comply with other requirements for COVID-19 providers. So this is, again, just action steps for us at the health department that we need to be able to accommodate minimum orders, ultra cold storage, and then identify other places besides the health department which can also possibly store some of these vaccines. So that's what we've been working on. We're continuing to work on it. That's all we know. You might have seen this story hit the news last night that we are going to get 100,000 doses of vaccine on December 15th. And, that's not quite accurate. What we told the news media is that we have the capacity to store 100,000 doses, and we feel like the first of those will arrive on December 15th. But somehow that got, that got transposed into this narrative that we are guaranteed to have 100,000 doses of vaccine. And I can tell you right now that we haven't had that confirmation from the state. I'm sure we will learn more in the next few weeks, and maybe even by the end of November, exactly how many doses we can count on having by mid-December. I don't know that it'll be 100,000 in that first shipment, but we'll definitely keep everybody posted as we find out more. Again, I think what we can all do is learn the overall contours of what to expect, get all of our patients excited about vaccination so that we can really take care of this vaccine skepticism out there. And then if you're in a position where you can help with operationalizing this vaccine in terms of you're working at a clinic where you can help deliver it, or you just want to help plan how this works with our pop-up events that we're going to be hosting through public health, then we certainly want to hear from you. I think this is one of the most exciting developments throughout this pandemic. And so I'm glad that there's a lot of enthusiasm and interest around this topic. I just hope that the state and the manufacturers can deliver on some of these aspirations that are now being fleshed out. Okay, just to switch gears again, let's talk about Thanksgiving and holiday gatherings. So this is another document that we've been working on because we have a lot of questions about gatherings and events. And while this is not strictly clinical, this might be just good information for you to have as you have informal conversations with friends and family. And hopefully you'll understand our rationale for why we need to make things more restricted in the purple tier. So just remember that the safest approach is just to stay home. If you want to be a hermit this year for Thanksgiving, hey, no harm, no foul. Basically, that's really going to keep you safe and keep your family safe. And there's really no shame in doing that. However, if you are going to have an allowable gathering, then ensure everyone's wearing a mask. Ensure that different households maintain a 6-foot distance. Ensure that hand sanitizer is available or people are washing their hands. Do not do buffets or potlucks. Food trucks and pre-wrapped individual plates are allowed. And all gatherings and events should be 2 hours or less. So don't make this a long gathering if you are going to host one or participate in one. Get in, get out, say hi to everybody, and just hold your breath for all those long conversations that we sometimes love to have over the holidays. If you're holding a gathering outside and using a shade structure, make sure that that's open at least on 3 sides. So this is one of the big infractions that we're noticing with our restaurant business is that people are putting tents out in the parking lot and then enclosing off 4 walls. And that defeats the purpose of being outdoors. So we basically want that ventilation, which can only happen if you have 3 sides open. And so just keep that principle in mind if you yourself are hosting an outdoor gathering and you decide to have a tent structure, that the whole point of getting people outdoors is to take advantage of the fact that natural circulation and aerosolization is just much less risky whenever people are outdoors. And whenever you start enclosing people into spaces, that actually defeats the purpose of being outdoors. And then keep in mind that the maximum number will include your hosts, your guests, and caterers and other staff. So with that, here's the actual document. That was just a preamble, and we've divided it up into types of gatherings, what's allowed in the red tier, what's allowed in the purple tier, and then exactly what type of gathering we're talking about. So we actually get a lot of questions about faith-based organizations and cultural ceremonies and religious ceremonies, such as weddings, funerals, etc. Basically, in the purple tier, only outdoor ceremonies are allowed, and only outdoor worship activities are allowed. Wedding receptions are not allowed. So wedding ceremonies are allowed outdoors. Wedding receptions are not allowed at all. Private gatherings, again, these should only be outdoors, and really only 3 households should come together. And that's whether we're in the red or the purple. Only 3 households should be coming together, and that applies over Thanksgiving as well. And try to keep it under 15 individuals so that everyone can space out and have their own space. And remember, they should be absolutely wearing a mask, even if they're at your house or if you're at somebody else's house. Wear a mask while you're talking to everybody, and only take it down whenever it's time to eat, and then put it right back up after you're done eating. Gatherings at banquet halls and event centers are not allowed. Drive-in events, again, we want to curb the capacity down to 25%. And then recreational and community classes are also outdoors only. So this actually, it's more of a tool to help the Department of Public Health get through a lot of the questions that we get asked. But I just wanted to share it with this group because I know you get asked these questions all the time also. And hopefully this gives you a good instrument to say, you know what, this falls into this category, and this is what the allowable rules are for that particular event. The CDC has been doing a great job throughout this pandemic, and they're really leading into Thanksgiving by giving people lots of other Thanksgiving ideas besides gathering in person, such as hosting a virtual Thanksgiving, just watching TV and playing games with people in your own household, doing some holiday shopping, and trying to do that as safely as possible, knowing that retail has to follow a lot of rules. And then just preparing dishes and delivering them to neighbors so that you don't actually have to eat together, but you can still partake in that communal spirit where you're bringing people food and hopefully enjoying Thanksgiving in a different way that keeps everybody a little bit safer. I just want to end on a note commemorating Dr. Garnica. I think some of us knew him, and certainly he had a long and celebrated career serving our community and also serving the hospitals where he had faculty privileges. He lost a long battle with COVID-19, and his family had some really beautiful sentiments that they shared with the media. And I just wanted to commemorate his passing. That's really all I have for today's presentation. We won't have a presentation next week because it's the Thanksgiving week. I hope you're able to get some rest and relaxation and spend time with your family and your loved ones and recharge for what is hopefully the final chapter of this pandemic. And now that we have these therapeutics and these vaccines being developed, I think that there is a light at the end of the tunnel. And I hope that we can end strong and end safe with whatever the future brings us. Thank you very much. We'll see how many chat questions we have. Okay, will we get a copy of this PowerPoint? Yes, we will send it out to everyone over your email. Can you please highlight the sensitivity and specificity of the Abbott antigen system? So that's actually on the FDA. It's in the 90s, and what they're saying is that it's the high 90s. So it is considered a really good antigen test. But remember, you have to select the patients correctly. You have to find that the patient is symptomatic within the first 5 days of symptoms. And we're also asking people to do a PCR at the same time. and send that at the same time at this time. Okay. So is there a charge? No, there's not a charge. And thank you very much. Dr. Jansen Linscheid is actually answering some of these questions. Feel free to chime in also. I know Dr. Linscheid has worked really hard on developing this packet along with Dr. Zweifler and some of our other public health physicians and staff here. So yeah, go ahead and speak up. I'd love for this to be more of a round table where everyone can share their thoughts.
Sorry, yeah, I can chime in a little bit. I was picking up kids at schools, but we will be, we're kind of getting together a coordinated effort to contact primary care offices so that we can answer questions and help get you set up with these cards, and then help with the reporting and kind of navigating all of that. I think there was also a question about whether it has to be used for symptomatic patients, and it's best used in the first 5 days of symptoms, but they're in the packet. If you read through the information on the Binax card on the website, on the Fresno County website, there is an exception for sort of like asymptomatic patients in certain surveillance situations. So read through that carefully, because there are some exceptions there that it can be used for.
Great. Thanks. I think we have a couple other questions about the vaccine going to different pharmacies. You know, I think the broad contour of this is that yes, it will be available. I can't answer exactly when and whether that will be in the first phase or the second phase. That really hasn't been worked out. I mean, the slides that I showed you are straight from the state, and that's the best information that I have. They'll be doing that meeting again next week and every week until the vaccines have arrived, and even beyond that. So we'll keep everybody up to date based on what the state is releasing. And so I think, yeah, the pharmacies are going to be involved in distributing this vaccine. I just don't know, exactly how that's going to, exactly how the timing of that's going to work out. Providers that want to provide this vaccine, first of all, you can take advantage of some CMS codes, and I'll try to incorporate that before I send these slides out. So there are actually COVID-19 vaccination codes that CMS has already approved. Second, they have to register, at least through the state of California, with a website that basically allows them to become COVID-19 vaccine providers. And I'll try to track down some literature about how that process works in case some of you are interested and haven't yet been approached about how to deploy this vaccine. But yeah, I mean, of course, we want all providers who are interested and are in a position to provide this vaccine to be ready to do it. And so we'll give you more information as we get it. What side effects are they seeing? Yeah, that's a great question. So again, what we have is interim analysis of the phase 3 trials. They need to release the actual papers and the raw data. Some states have actually said, we love the FDA. However, we're going to have our own independent review of the raw data before we actually approve this vaccine for use within our state. Most notoriously, New York City has said that. California is actually planning to do that too. They just haven't been as obnoxious about it as New York has. But I think a lot of states are going to kind of do their own independent analysis before they say that this vaccine is okay to be used within our state. So that, I know that the scientific committee at the CDPH is planning to kind of vet all of the evidence related to this vaccine. And whenever the FDA provides their emergency use authorization, they actually have really good details about exactly the rationale and some of their concerns, if they have any, related to data that needs to be submitted furthermore. So I think we'll find out more about the side effects. Another question is, with the flu mandate, we require all healthcare workers to get the flu. And as you know, I feel really strongly about that. I've taken a really hard line this year. I don't think we can afford to lose any lives to the flu this year. And so I just have taken a really hard line on making every healthcare provider get the flu shot or have a really good excuse why they don't want to get a flu shot. It'll be a little different with the COVID vaccine. I mean, it's so new that it's hard to take that hard line. And so it will basically be a voluntary or an opt-in model as opposed to a mandatory vaccine that people have to get. But nonetheless, you know, we want people to feel comfortable getting it. We want people to understand the science of you know, how effective this product is. We know that there's going to be some early adopters, some late adopters, and the vast majority will be somewhere in the middle. That's just how new technologies work and new medications work. Whatever conversations you're having with your staff, you know, I would say please try to be upbeat. Please give the scientists that are working really hard the benefit of the doubt, aside from just how politicized every single thing with COVID has become, and just say, you know, the FDA has a great track record. The CDPH is committed to doing the right thing, and just kind of promote a real upbeat and enthusiastic attitude about getting this vaccine out there, because I would hate for vaccine skepticism to really be just another encumbrance to an effective pandemic response. And I think all of us have a role to play in the healthcare space to make sure that our patients and our staff really feel comfortable with the concept of a vaccine and with the specific vaccine products that are out there or going to be out there very soon. So again, people are asking about the Binax cards. Really, that 4-page packet will answer a lot of your questions. Another question came up is if you do a PCR with the Binax card, who pays for the PCR? Well, remember, that's something that the insurance will cover for symptomatic patients. And so that's something that, you know, you should already be doing the PCR with your symptomatic patients to rule out COVID. And that really won't change with the addition of this other testing modality. It'll just mean that you're swabbing the patient's nostril a couple more times, but then giving them the diagnosis or a preliminary diagnosis within 15 to 20 minutes, as opposed to 2 to 3 days later. And speaking of the PCR best practices, please make sure that your patients are getting the PCR in a timely fashion. So we're hearing some rumors and complaints that you know, whenever a patient is requesting to get tested, they're being told that they have to schedule an appointment that's a week out. That completely defeats the purpose of doing testing in a pandemic. I mean, you know, waiting 7 days to test someone who's symptomatic or is you know, at risk because of an outbreak, it's really not acceptable. So again, that's why we put out that mandate. We expect a patient to get tested within 24 hours of requesting it, provided that they have a rational request. And either you need to do it or you need to have some sort of understanding with one of your partner facilities to get that done, and then refer the patient over to get that done in an expeditious fashion. We're also hearing that the clinics are experiencing longer and longer result times and turnaround times. Please give us some feedback about that. We actually have a tab on our website. Let me see if I can find that in real time. But we actually have a tab on our website that that is all about the testing process, and we want people to give us feedback about how that's going. And that's really so that we can help troubleshoot all of these issues. And let me see where that is. Oh yeah, testing feedback. So if I can share my screen again. So if you go to this website, and again, this is our Fresno County website. If you go here on the left-hand column, it says COVID-19 testing sites and then COVID-19 testing feedback. This is a new tab that we just put in, thanks to my communications team, Sim and Michelle. And the testing feedback is basically, you know, giving us feedback about how this is going, so that we can actually help troubleshoot and pinpoint trouble spots. So basically, you know, did you get a test? How was your experience? Were you turned away? How long did it take? Were the staff friendly, et cetera, et cetera. again, you know, if we start to see a signal in the noise, we may have a conversation with you and say, you know, how are things going? What can we do to help? We're noticing that you're having some trouble. Or if you yourself want to explain that you're not able to track down reagents, you're not able to track down supplies, you can use this. You can always email us, obviously, also, but you can actually just use this form to say, you know what, I have the ID now and I'm not able to order supplies. Please help me. Somebody actually made that request to me yesterday, and I actually tried to relay that to our Mohawks and some of our other resources. So we want this to be a useful tool for everybody, for the patients as well as for the providers. But I just want to let you know that this is on the website now, and it's called Testing Feedback. And it's in the chat box too. Thanks, Sim. All right. Well, I hope everybody has a great Thanksgiving next week. I know it's a busy time, so take care of yourself. Please stay safe out there. I mean, you know, the trends that I'm sharing are really causing me a lot of concern, and I care utmost about our healthcare workforce. So I want you to stay safe, stay well. When we get back from Thanksgiving, I'll continue to share about these topics, but then also flesh out in a more formal way some proposals that I have about surveillance testing of our healthcare workforce and where we need to go with that. And so we'll talk more about that. Again, I want that to be a dialogue. I want it to work well for everybody, but I think we're at a time when we need to really think about doing some regular baseline surveillance testing within our healthcare workforce. And please give that some thought. I'm going to give that some thought too. And in about a week, we'll convene. In about 2 weeks, we'll convene again and think about what that might look like for Fresno County. All right, and we're at the hour, so if there's no other comments or questions, I think we'll adjourn there. Thanks for the great feedback, Daniel, about getting tested. Good job. Thank you. We'll send these slides out later. Bye.